posted on our YouTube channel. So good morning, everyone. This is Barry Cohn. I'm the CEO of Jorgensen HR and also the president of Really Great Employee Benefits. As some of you know, we're now sister companies. So the webinars are all based on Jorgensen HR logos and things of that nature. So we're going to get started today. You know, in this environment, we have the lowest unemployment we've ever had in this country. It's 3.5%. People are having a lot of trouble, employers, in finding candidates and finding good candidates. And in addition, they're having a serious problem with something known as ghosting. And I'm writing a blog entry right now about ghosting. But ghosting is where employees contact you, you contact them, you like their resumes, you're going to have them for an interview, and then they don't show up. Or they accept your offer, and on the first day of their employment, they don't show up. And they don't contact you and what have you. And statistics are interesting. So because of that, I think it's really important to understand employee engagement as well as employee benefits and what's happening around the country. So as always, we have a disclaimer. The webinar is provided for informational purposes only, not to be relied on as a substitute for legal, accounting, tax advice. If it's regarding legal, please contact your employment attorney for legal advice. So our employee benefits survey, every single year, I've done one for the last 5 years, and I take the information from 3 employee benefit surveys that are out there every year. One is the Kaiser Family Foundation. Now, the Kaiser Family Foundation is not connected with Kaiser Permanente. It's a separate entity, and it's a healthcare foundation. MetLife does an annual study, and then the Society of Human Resource Management does a study every year. In addition, because Really Great Employee Benefits has 350 employers, we sort of do a survey of our own clients because we know what they're offering and what they're doing. And then recently, I've added some employee engagement information. Gallup did a study, which is fascinating, about employee engagement. And just this week, Bamboo HR, PayScale, and Office Vibe put out an e-newsletter about employee engagement, and I decided to add some things from there. To give you an idea about employee engagement, it's estimated the cost of replacing an employee is up to 200% of their salary. And it's based on the fact that you have to hire people, post job offerings, retrain, train people, get them up and running, get them productive. And so I've seen statistics where it's 30% to 200%. 33% of employees are engaged in work. They're happy, they're engaged. 51% say right now they're actively looking for a new job or watching for new openings, which is really interesting. And the statistics are up there about pay and feeling appreciated and what have you. But the most alarming thing I've seen, and I've seen this in 3 different surveys, is that 50 to 60% of employees do not believe they're going to be working at the same company a year from now, which means that 60% of your employees may be looking for a new job or maybe looking for a better opportunity. And then the question is, why are they looking for a better opportunity? And the issue right now is with unemployment at 3.5% and 50% of people that are applying for jobs not attending their interviews, there's a lot of work involved in finding a new employee. So it's really important to make sure they're engaged. Some other employee engagement facts, which came from the Bamboo HR study. 41% lower absenteeism when you have good employee engagement, 50% lower turnover, 70% fewer safety incidents if you're in the manufacturing area, distribution area, warehouse, 40% fewer quality incidents, and that would be quality control if you're manufacturing something, but it could be quality control in a distribution environment regarding shipments that are incorrect, etc. Higher productivity, higher sales, and higher profitability. Disengaged employees are estimated to cost the U.S. between $350 and $450 billion. So it's a big number. So it's really important to make sure we keep our employees engaged. As an example, In our company, well, one of our companies, Really Great Employee Benefits, we have a masseuse that comes in twice a month. And from 12 to 3 on a Friday, all the employees get a half an hour back massage. Also, Monday was National Chocolate Day right before Halloween. So we brought in chocolate for everybody in the afternoon. We brought 4 or 5 different kinds of candy in. I know I should be bringing in healthy things, but we try to celebrate items, National Hot Fudge Sundae Day, or various items that make people engaged and happy working where they work. So talking about why employers offer health coverage, 83% say it's to retain employees. 78% believe it increases employee productivity. 77% believes it increases employee satisfaction. So employers that are offering health coverage are doing it to retain, engage, keep their employees happy. A lot of employers want to keep up with the Joneses, so to speak, so they want to be competitive with other employers in their area, and also they want to be competitive with other employees in their industry. So for example, on the benefit side, we handle 12 synagogues and about 50 nonprofits. Jorgensen HR handles about 30 nonprofits. And we keep track of what nonprofits are doing to make sure that all the nonprofits are aware of what other nonprofits do in the area of employee engagement, benefits, what have you, in order to be able to retain and attract people. Employers offering coverage. The numbers have changed recently, but obviously in the larger companies, 50 and above, you see 93% are offering coverage and 98% 200 and above. But the coverage for employers that are below 50 has changed in the last 8 years since the Affordable Care Act, and the numbers have gone down a little bit. So 77% of employers 25 to 50 offer benefits. 10 to 24, it's 63%. These numbers are down 10 to 15% over 8 years ago. A lot of that has to do with the cost of health care. Let me rephrase that. The cost of health insurance, which has been going up, and the benefits have been going down. And so a lot of smaller employers are questioning whether to offer benefits or not. Types of benefits offered, and this is for all companies less than 500 employees. 95% offer medical insurance, 69% offer dental, 56% offer vision. So most of the time what you'll see in companies 25 and over are medical, dental, vision, and life. A lot of times disability and other voluntary products are not offered as much. But we'll see some statistics in a little bit about voluntary products and how millennials feel about them. Millennials are not quite 50% of the population of employees yet, but within 2 years, they're going to be 50% of the employees that we have working for our companies. If you look at other insurance, which would be considered and other benefits, 94% of employees surveyed consider other insurance offerings important. And that includes commuter benefits, sick time, flexible schedules, maternity, paternity leave. In California, it's required to have parental family leave now, up to 6 weeks, unpaid, intermittent leave if you have under 50 employees. And we have one employee right now whose wife just had a baby and he's on intermittent leave. And you can have intermittent leave up to 12 months to bond with a new child or a child that you've adopted. 72% think that voluntary benefits are important. So we'll talk more about voluntary benefits. Voluntary benefits fill in the gaps of healthcare coverage. 63% believe voluntary benefits are helpful. 79% say it's great, but they're not sure they want to spend their own money on it. 88% like the idea of other choices to customize their benefit packages. What we're seeing across Southern California, all of California, and really across the nation are that employers are really trying to generate benefit plans that match different employee groups. People that are in their 20s and are unmarried have different benefit needs and healthcare requirements than people in their 30s that have families, or baby boomers that are in their 50s and coming into their 60s. So it's good to have a variety of offerings, and employees seem to like that. They like the idea that They can choose between, if you're in the small group market under 100, a gold plan or a silver plan, or if you really want great benefits or you have some medical issues, a platinum plan, rather than just one plan. There's still a lot of employers that only offer one benefit plan. There's no reason to do that anymore. I would say that 90% of our benefits clients offer 2 to 6 benefit choices, usually 2 or 3 HMOs and 2 or 3 PPOs, usually a silver gold plan, a different deductible and different co-payments. And I think people really like that. 90% of employees right now found that interactive digital experience is helpful. We probably have close to 100 employers now that are doing all their open enrollments digitally online. We have 2 employers that are starting up on December 1 with us, and they're going to do all the enrollments online. And the open enrollment meetings will be digital using something like what we're doing today. We have a couple of Jorgensen clients that we are partners with in a best partner program, but are looking to go paperless and put all their HR online so their employees can have a digital experience, because half the employees, that's what they do. They like their cell phones, they like their pads, they like their Kindles, and they want to do things without having group meetings and without having open enrollment meetings. Voluntary benefits. Why do employers offer it? To enhance the core benefits, give more personalized options, appeal to multi-generational workforce, which we've talked about, and also attract new employees and support retention. So let's talk about what employees want. Employees want, 81% want medical benefits, and 16% would like to say that it's nice to have. When you add that together, you got 97% of employees in the surveys that came from the 3 employee benefit surveys we've used. They want health coverage. They want coverage to help them finance their health care. 64% want dental, 30% nice to have. Again, 96% would like dental. Vision, 94% would like it. Life insurance, 92%. And 401k, 94%. It's interesting about retirement plans and 401ks. The latest statistics about millennials are they really want retirement plans. And you may say, wow, they're only in their 20s. Why? Well, they're concerned about Social Security. They're concerned about whether there'll be anything there for them when they decide to retire. When it comes to disability income protection, the numbers are much lower. Because people don't really understand what that is, and they don't understand what paycheck replacement is. And then the supplemental policies, which would be accident, cancer, critical illness, the must-haves are much lower. But obviously, when you look at people that say it's nice to have, the numbers are higher. So let's talk about the employees' top financial concerns. And this is a new slide this year. And the reason is that there's a lot of talk about financial wealth, financial wellness, and what employees are concerned about. So if you see that 72% of employees they're concerned about the affordability of healthcare in retirement. They're also worried about outliving their retirement savings, which is 68%, and having money to pay bills if somebody loses their job, which is 67%. So the first 2 speak to 401ks. And retirement benefits. This middle one talks about, 2 earner income. I have 5 kids. Some of you know that. I have 4 daughters and a son. We have 2 marriages and 1 engaged. And so, they buy houses. They have 2 incomes. But if one person loses an income, they're going to have trouble. And people are really worried about that, especially millennials. Having money to cover out-of-pocket medical costs. So when you look at the new out-of-pocket costs, which we'll see in a few minutes, people are really concerned about, if I get sick or have an issue, how am I going to pay my out-of-pocket costs? And then the ability to rely on Social Security or Medicare, 66% are concerned about it. So as you see, there's a lot of financial concerns. And the latest topic in the HR magazines and HR blogs and HR internet sites are financial wellness, and it's something to be aware of. Moving on, healthcare benefits offered nationally. you see that 84% offer PPOs, 35% HMOs, consumer-directed health plans, which are high deductible plans, are 40%. Now, this is not California. This is around the country. Around the country, PPOs are primarily what's offered, and HMOs are actually considered better plans in a lot of states, especially the tri-state area of New York, New Jersey, Connecticut. HMOs and what are called EPOs, exclusive provider organizations, are considered better plans and they're more expensive. In California, the numbers are very different. In California, HMOs are still 54% of what employees take in enrollment, and 35% are PPOs. I do show that 11% are looking at high deductible or health savings account compatible plans, but firms offering high deductible plans are 29%. The issue in California is that the high deductible plans are not very attractive rate-wise. 10 years ago, when high deductible plans came in health savings accounts, they were very attractive compared to PPO and HMO pricing. So a lot of companies went to a health savings account compatible plan, and then they offered to pay into the health savings account to help their employees with the deductibles. But that's really, in California, there's not that much of that anymore. Employer waiting periods. The most common waiting period now is first of the month after 60 days. We always get the question, well, the federal government says 90 days is the maximum waiting period. But the problem is you don't hire someone the first of the month usually. And for months that have less than 30 days or less than 30 days, like February, or more than 30 days, but have 31 days, the first of the month, 90 days will put them in the middle of the month. So 62% first of the month after 60 days, 18% first of the month after 30 days. Since we work with so many nonprofits, what you'll see with nonprofits is first of the month after hire or 30 days, because nonprofits have a history of not paying as much in way of wages, so they have better benefit plans and they offer the benefits earlier. Date of hire says 8% in the small group market in California, under 100 employees, and carriers will not permit that. But over 100 employees, we have clients that you get your benefits the day you get hired. So that kind of gives you an idea about waiting periods. Share of premium, and this is for the under 200 market. Only 5% of the companies out there pay 100% of the employee portion of benefits. 15% are in the 90 to 95% range. So you end up looking at 5% of the population providing 100% of the employee benefits for medical. But most commonly, what we see is in the 70 to 80% range. And although it says 80 to 89% or 70 to 79%, normally you see 70%, 75, 80, 85. And you see that 60% of the companies out there are paying 70 to 80%, 85% of the benefits. But companies that are in the 50, 60% range are 20%. The ones that are at 50%, that's because the federal government under the Affordable Care Act says that you have to pay at least 50% of the lowest offered plan. And because of that, some companies offer a 50% of a plan. Most companies do not provide contributions for dependents, although you do see that in some companies, especially entertainment, high tech, and some larger nonprofits. Employees with 200 or more employees, you see 84% of the premium is the mean for what companies pay, and 16% are the employee costs. So, as an example, as a benefits firm, I offer really good benefits, medical, dental, vision. We pay 100% of all of it for the employee for an HMO, medical, dental, and for vision, which is very unusual. But most companies, what you'll see is the 70 to 80% range. Out-of-pocket maximums. I'm going to talk HMO first and then PPO. But as you see that most companies now have $3,000 and above out-of-pocket maximums. 35% 5,000 and above, and 25% 3,000 to 5,000. The reason is under the Affordable Care Act, the carriers have to create plans that are actuarially consistent with a silver, gold, platinum, bronze plan. And the most common out-of-pocket costs now for silver and bronze and gold plans in California are $5,000, $6,000, $7,000. The Affordable Care Act in 2020, next year, will permit out-of-pocket costs to go as high as $7,900. Now, how many of your employees can afford a $7,000 or $8,000 out-of-pocket maximum if they end up going to the hospital and having surgery? Now, statistically, only 5% of the population will ever hit their out-of-pocket max in any given year. 95% will never hit their out-of-pocket max. The only time you're going to hear out-of-pocket max is if you go to the hospital and you stay overnight for surgery, maybe outpatient surgery. And if you have cancer and you have chemo, you will definitely hit your out-of-pocket max. So as some of you know, 4 years ago, I had chemo for 4 months. Exactly right now, I finished December 1, 4 years ago. After my first chemo treatment, I hit my out-of-pocket max, which was $5,000. So for the rest of the year, September, October, November, December, I had no out-of-pocket costs because I hit my out-of-pocket cost in August. But if you have surgery, you're going to hit your out-of-pocket costs if you stay overnight. But most people will not hit their out-of-pocket costs, even baby boomers. And as an example, I like to give examples, and this is an example using myself. I go to my regular family physician 4 times a year. And because of my leukemia, I go to my oncologist 3 times a year. So that's 7 office visits. I'm on 5 prescription drugs. Hopefully I'm going to be on 3 next year. But right now I'm on 5 prescription drugs. And I don't even get close to hitting $1,000 in out-of-pocket maximum. 4 of my prescription drugs are generic drugs, $5 a month. 1's a brand name drug. My doctor visits are $25. My specialists are $35. I'm never going to hit my out-of-pocket costs. I have blood work done 7 times a year. But with all that, I still never hit $1,000. So last year, I had a $1,000 deductible on my plan. I never even hit the deductible. So the fact of the matter is that 80% of the population will never hit even a deductible of $1,000 because they're healthy, they're young and healthy, or they're even in their 40s or 50s and they're healthy. So it's something to be aware of, but out-of-pocket maxes scare employees. They look at that number and they really get concerned. Office visits, you're seeing more office visits in the $20 to $25 to $30 range now. And you see 63% of the population, employees have office visits of 20, 25, 30, 35 for a regular office visit. Very common now. Cost sharing for HMOs. Most of them, cost sharing would be labs, x-rays, hospital. Most of them have a per admission charge. So if you go to the hospital, it's $500 a day for 5 days, or it's $300 a day for 3 days. Some of the silver HMOs now have cost sharing. So instead of a per admission charge of $500 or $1,000 to go to the hospital, you now have a 20% cost sharing. So a lot of the silver plans now, the carrier pays 80%, you pay 20%, or 70%, 30%. The per day is very common. Most of Kaiser plans are $100 a day for 5 days, or $250 a day for 5 days or 3 days. And the per admission charge, which is just a copay, you don't see much any longer. Some deductible plans that have higher deductibles, which would be silver plans with a $1,500 deductible or $2,000, it only applies to hospital. It doesn't apply for office visits or labs or x-rays. So those deductibles that might look high may not affect 80% of the population. Moving on, out-of-pocket maximums for PPOs. Again, you're seeing a slow increase, 3,000 to 5,000 out-of-pocket maxes, 35%, and above 5,000, 52%. That's usually 5,000, 6,000, 7,000. And as I mentioned earlier, the Affordable Care Act is allowing it to go higher. So what happens with silver, gold, platinum, bronze plans, and I don't talk much about bronze plans because of our 350 clients that are in the benefits area, maybe 3 or 4 have bronze plans. They're really garbage type plans. We don't like to offer them. But silver and gold plans and even platinum, the carriers have to have a certain actuarial value for these plans. So on a gold plan, 80% of the premium has to go to healthcare costs, and 20% can be out-of-pocket costs for the employee. On a silver plan, it's 70% and 30%. So what happens with these plans are every single year, the carriers have to look at deductible, office visit, co-pays for labs and x-rays, hospital, prescription drugs, and try to make that actuarial value hit between a range. So a gold plan, the range is 78 to 82% is considered a gold plan. A silver would be 68 to 72% the carrier has to pay for actual health care. And so these plans have tweaks, and the government lets them tweak the out-of-pocket max, which is why it's been going up. If a carrier does not meet that requirement, so if a gold plan is 78 to 82%, and they only spend 75% on medical care and for payment reimbursement, then they have to give a rebate to the employees called a medical loss rebate. We're getting a lot of them right now for the 2017-18 year. And one of our clients yesterday, an 80-person company in Santa Monica, just got a check for $16,000 as a medical loss rebate. What that carrier is telling them is, we did not spend enough money on medical care and we charged you too much in premium. We got to rebate you the $16,000. But then we got to figure out, as a benefits firm, we have to figure out how much is the employer portion, how much is the employee portion. It goes to any employee that was employed during that time period. So out-of-pocket costs are rising. Office visits, you're still seeing some $10 and $15 office visits, but most are 20 or 25. The PPO that I've been on for the last couple of years, the office visit is $25 for my regular family physician and $35 or $40 for my specialist. You're seeing that as a very common thing on gold and silver plans. Annual deductibles are also going up, but as you see, 40% are in the $2,000, $2,500 range, 31% are in the $1,000 to $2,000 range. You're not seeing very many with low deductibles anymore. Those would be platinum plans. And you're not seeing too many of those being offered because of the cost. Annual deductible for family coverage. Again, family coverage, and I put this deductible picture up and covered up to $6,000 a little bit. Sorry about that. But for families, if the deductible is $3,000, then the family deductible is usually $6,000. 2 people have to meet that deductible. So you're starting to see family deductibles in the $4,000, $6,000 range. Again, these numbers are all in network. If you stay in network, whether it's Anthem Blue Cross Network or Blue Shield Network or United Healthcare Network or HealthNet for PPOs. And then with Kaiser, obviously, you're always in their network. Hospital cost sharing for PPOs, 65% are co-insurance. Some companies are having co-insurance and a co-payment. So for example, if you go to the hospital and have surgery at a United Healthcare and I believe Blue Shield on some plans, you pay $250 plus the co-insurance, where it used to just be the co-insurance. If you go to an outpatient surgery center and you do it in a hospital, you may have a co-pay plus the co-insurance. You go to an out-of-patient surgery center that's not connected to a hospital, which is less costly, you just have the co-insurance. So we're seeing this spread a little bit to a co-insurance and co-payment, and I wouldn't be surprised if a year from now that's going to 30%. Prescription drugs. We're seeing a rise in prescription drugs. Generic drugs, the average on PPO and HMO plans are $20 for generic, $40 for brand name drugs, $70 for non-preferred or non-formulary brand name drugs. And you're seeing drug deductibles for brand name drugs. Most carriers now are not calling it generic, brand name, and non-formulary. They're calling it tier 1, tier 2, tier 3. The reason is because some generic drugs are going up in price and the carriers want to push it to a tier 2. But as most of us know, you can buy generic drugs for $5 at pharmacies. So if you go to CVS, you go to Walmart, you go to Costco, you go to Rite Aid, you can get $5 generics. So what we're telling employers now are to make sure they're helping their employees save money on prescription drugs. And there's many ways to save money. One of them is to pay cash for your prescription drug and not buy use your insurance and pay $15 or $20 for a generic. You'd rather pay $5. There is legislation in California that will start, I believe, January 1st, that forces an insurance carrier to allow the $5 charge rather than the generic charge. I'm waiting to see the legislation and see what the governor signed, but we may be seeing a change in California, but not in other states where you will automatically get the lower cost. But even brand name drugs with deductibles, we want to make sure employees don't pay more than they should. So there's websites like GoodRx and Health Warehouse where you can buy a drug cheaper. What's interesting is in the smaller market, 100 and below, you don't really have much choice in California, and even below 250 employees, because if you're in the 100 to 250 employee market, you still have drug plans. But in the larger company market, there are a lot of employers around the country now that are going to an independent pharmacy benefit manager that is not affiliated with a health insurance carrier, and they're buying generic drugs in what's known as tier 1 countries, which is Canada, England, Australia, New Zealand, because employees and consumers in the United States are comfortable with drugs that come out of those countries. So they're buying generic drugs overseas at half the cost, or 60%, 70% discounts. And they're buying the brand name drugs overseas. I just said generic. And generic drugs are buying here. So larger companies are starting to find ways of lowering their costs of their medical plans. Unfortunately, in the under 250 market in California, it's very hard to do. Companies offering ancillary benefits. Less than 250 employees, 85% offer dental, 73% offer vision. Most of the time we see companies paying 100% of the vision because the vision premiums are in the $10 to $14 range. Sometimes you can even get them below $10. Dental, most companies are paying for 100% of the dental HMO, which again are in the $12 to $14 range. And the PPO becomes a buy-up. 77% offer life insurance, and disability is starting to become 67%, 66%. I'll make a quick point about disability. In California, short-term disability has changed in the last couple of years. SDI now pays 60 to 70% of an employee's income. So if you have a short-term disability plan for your employees, it integrates with California SDI. It integrates with Social Security disability. And so a lot of companies are looking at their short-term disability and saying, I'm paying a lot of money, but my employees aren't getting anything. So the old short-term disability plans where you get 60% of your income are starting to go away. And I just quoted disability for a 150-person company where we're only going to be offering 20% for short-term disability, and it does not integrate with state disability. So whenever I see companies now that have disability, I'm saying to them, hey, has your broker or have you looked at short-term disability in the last 2 years? Because you may be paying for disability where your employees are only getting 5% of the insurance from the carrier that you're paying money for. Supplemental insurance, 47% are still offering it. Dental benefits, 81% offer PPO, 8% offer HMO. What we find a lot is there's a lot of companies, especially white collar companies, companies that are in the entertainment business, technology business, even in the nonprofit world, that are offering and paying a portion of the PPO because it's a better plan and they want their employees to have it. The most common dental plan. This is the most common dental plan in California and around the country, but things are changing. The annual maximum is $1,500, 100% for preventive cleanings and x-rays and exams, 80% for basic services, which includes gum disease and root canals, and 50% for major. Now, what's interesting about that is that $1,500, you're starting to see some carriers that are going up to $2,000 and $5,000. It sounds really good. You know, I get a $5,000 dental benefit. And Humana in California is now offering an unlimited benefit. Employees love the thought of an unlimited PPO dental benefit. But in reality, only 2% of the population ever goes above $2,000 in dental benefits. And the people that go above $5,000 are like less than 1%. So a lot of carriers, because 100%, 80%, 50% is common, and there's no magic with dental benefits, they're trying to put some dogs and whistles and into this to make it look like they got better benefits. So Humana has this unlimited benefit. Guardian has something called maximum rollover, where if you get your preventive every year, but that's it, you get to roll over some of that to the following year. But when you look statistically at how many, what percent of the population goes above 1,500, it's only 5%. This is the most common. Most common vision benefit, $10 for exams and for frames, and 12 months for exams, 12 months for lenses, 24 months for frames. The frame allowance used to be $120. We're seeing that move to $150 lately in the last year. And there's some carriers that are offering $160 and $180 frame allowance. So there is some changing of the guard and regarding vision benefits and with respect to frames. Looking at supplemental benefits, employee assistance programs. 77% of employers are offering employee assistance programs, but in reality, only 3% of employees actually use them. We've done some statistics with some of our clients that have employee assistance programs. They're very good for employees that have elderly parents. They're going through divorce. They have some issues regarding depression or issues regarding childcare or what have you. But although people have them, 3% use them. But 90% of the time when you have life and disability, the EAP is thrown in automatically. Life insurance, 47%. Critical illness, cancer, accident, legal. You can see the percentages there. Pet insurance around the country is probably the hottest new insurance. Employees really care about their pets, and a lot of employers are now offering it. We offer identity theft and pet insurance through a company called Fresh Bennies. The identity theft is through one of the major one or two companies that do identity theft in the country, and there's some legal that are offered too. But this kind of gives you an idea of supplementary. Voluntary plans, the supplementary, we have accident, critical illness, hospital. I would tell you that when accident and critical illness and cancer is offered to a group on a voluntary basis, you'll see 60% of the people buy accident insurance or critical illness, and also cancer insurance, which is on the next slide. Cancer insurance pays really well if you get diagnosed. As a quick example, I have cancer insurance through Aflac. I've had it for, 15 years. When I got diagnosed with leukemia 10 years ago, I got a $3,000 check from Aflac because I had cancer. And every time I had chemo, I got $350 for having chemo. The reason that you get money for different types of services are because when you're having chemo, you can't drive yourself and come back. You need someone to help you. The other plans that are becoming more popular are bridge and gap plans. So with higher deductible plans, $5,000 out-of-pocket maxes and $7,000 out-of-pocket maxes, a lot of companies are offering bridge plans, whether it be Aflac or Colonial or Unum or MetLife or what have you, you get a bridge plan that says that if you go to the hospital and you have some out-of-pocket costs, they're going to give you a little bit of money to pay for your deductible and coinsurance. What the carriers are hoping for is sort of the health club model. In January, everybody joins a health club. They pay $25 a month, but 80% of them stop going by March or April, but they still collect the money. So on the bridge and gap plans, what the carriers are hoping for are they get a lot of people but buy it, but not very many people who actually go to the hospital. As I mentioned, only 5% of the population. So if 60% of the population buys a gap plan, but only 5% use it, it can be a profitable thing for the carriers. But again, it helps you with that gap between your deductible, your out-of-pocket max. So it's important. Retirement plans, just to give a quick 93% offer 401ks, 74% offer matches. But I want to mention that in California now, starting in January, we have a CalSavers program. So, but if you don't offer a 401k plan, you have to enroll in CalSavers. And it goes, let me rephrase this. The CalSavers program is implemented over 3 years. Larger companies in January, smaller companies in January 2021, and the smallest companies 2022. You have to enroll as an employer, and then the employees will have a 5% deduction from their paycheck that goes to CalSavers automatically, and they get into a 401k plan under CalSavers. The issue with CalSavers is that it's an automatic enrollment. However, employees can opt out within the first 30 days. So it's a new program. We'll be running a webinar on that coming in January. Most larger companies have 401k plans, so I don't think it's going to really pertain to people until the following year, but I wanted to mention it to you. Along with health plans, Section 125 plans provide employees the ability to take their portion of the premiums pre-tax and also provide them a flexible spending account where they can deduct money out of their paychecks pre-tax and pay for their out-of-pocket medical costs. So as an example, you can pay if I have a deductible of $2,000, I have out-of-pocket costs, I can put money away on a per paycheck basis and put it into my flexible spending account and pay in pre-tax dollars. Flexible spending accounts as a premium only plan portion of it. If you're not large enough and you don't want to have the other two portions, which we'll talk about in a second, you can still have a premium only plan. They're very inexpensive, about $125 a year to have it. And then your employees can pay in pre-tax dollars for their portion of their medical, dental, vision premiums and some of their supplemental premiums. Medical reimbursement. This is for 2019. I think it goes up again in 2020. But you can use pre-tax dollars for predictable out-of-pocket expenses. You can pay for your co-pays, deductibles, prescriptions, certain health-related supplies and services, dental care, vision care, out of your medical reimbursement. So using myself as an example, I mentioned that I go to my doctor 7 times a year. I have $100 in office visits with one, and I have $90 with another. That's $190. I take those 5 prescriptions. I spend 4 is $20 a month, which is $240 a year. And then my brand name drug, which is $40 a month, which is $480 a year. Those are predictable expenses. If I add up the $480 and the $200, that's $680. I add my office visits of $80 and then my other office visits. You know, I'm going to get around $600 a year, but I'm spending out of pocket. Okay, well, why wouldn't I put that through a flexible spending account? Take that $600, divide it by 24 pay periods, and now I'm paying in pre-tax dollars. By paying in pre-tax dollars, I'm saving, on average in California, 25% in taxes. So, you know, companies that are over 20 employees, usually over 15, they'll have a flexible spending account. Companies under will have a premium only plan account. And larger companies will also have transportation benefits. So if you have a transportation benefit as part of your FSA, An employee can take $265 a month for parking or for transit. This would be subway, bus, what have you, and pay in pre-tax dollars. So it's always better to put more money in your employees' pockets to have these kind of plans. So let's talk about engaging employees a little bit. The best way to engage employees is to take the pulse, do an employee survey, get a feel for employee engagement. Practice open and honest two-way communication. If you look at employee engagement surveys, most employees feel disengaged because they don't have a good relationship with their supervisor or boss. They never get appreciated. They only get talked to when they do something wrong. And a lot of times the company will not make decisions that are part of what their core value and mission statement is. And the employees are going, well, in the employee handbook, it says A, B, and C, but they're not really doing that. Millennials, when you study millennials and you look at what they feel about employers, they want their employers to care about them. They want to have open communication. They want to have a culture of appreciation where they get patted on the back. Now, we can make an argument that millennials, when they were growing up, got participation trophies and all of that. I'm not going to argue that point. But to be aware of it, now that they're in the workforce, they want to feel appreciated. And they also want to feel they have an impact on the community. They want to make sure whatever they're doing for work has an impact on the community and society. It's very important to them. So that kind of finishes up our employee engagement, employee benefits survey. This is being recorded, so you will get a copy of it, a link to the recording, and you'll also get a link to these slides. If you have any questions about the employee benefits survey or about benefits or about what other companies are doing, please feel free to email or call me. We also have the ability now to do benchmarking. Through one of the carriers, the largest carrier in the country, we're able to take an SIC code and compare your benefits to other benefits for companies in California, Arizona, Washington, Oregon, or the whole country. We can do it by SIC code. We can do it by size of company. So if you want to see how your benefits compare to other companies in your region or other companies of your size or other companies that are in your industry, manufacturers, distributors, what have you, we have that tool now. And we're more than happy to help you with that and kind of give you a comparison of your benefits to what other companies are doing. If anybody has any questions, please feel free to type a question in here. I'll wait a minute or two and see if we have any questions. I don't see anybody typing yet. Usually tells me when people are typing. So I'll wait another minute. Well, having seen none or seeing nobody typing, I will let you know that next month we're having our webinar on leaves of absences. Leaves of absences including pregnancy disability leave, paid family leave, parental leave, Family Medical Leave Act, FMLA. We're also going to have talking about other leaves. And we're going to be asking an attorney, Sherry Shavit from Tharp and Howell, to do this leave of absence webinar for us. So look for it in November or early December. We haven't hammered out a date yet. So that'll be our last webinar of the year. And then in January, we'll do our annual labor law update. I am going to a couple labor law seminars and webinars soon. I just read all the new laws that just got passed, and we always do our labor law update in January. So I hope people, you guys will attend it and take a look at it. Having seen no questions, thanks for attending today, and we look forward to seeing you next month on the Leave of Absence webinar. Thanks.